Welcome to today's medical deep dive. We're tackling a condition that often flies under the radar: bladder diverticulitis. We'll explore what it is, why it happens, and how it's managed. Get ready to understand this often overlooked aspect of urinary health. So, what causes bladder diverticulitis? Unlike diverticulitis in the colon, bladder diverticulitis isn't primarily caused by a low-fiber diet. Instead, it's almost always secondary to some form of bladder outlet obstruction. This obstruction can stem from an enlarged prostate in men, urethral strictures, neurogenic bladder dysfunction, where nerve damage affects bladder control, or even chronic constipation straining the urinary tract. Essentially, anything that creates increased pressure within the bladder over a long period can lead to these pouches forming. Now let's understand the pathophysiology, or how this condition develops. The prolonged high pressure inside the bladder weakens the bladder wall, particularly at points where blood vessels penetrate. This weakening allows the inner lining of the bladder, the mucosa, to herniate or push outward through the muscle layer. These outpouchings are the diverticula. Because they lack a muscular layer, they don't contract effectively, making it difficult to empty completely. This retained urine within the diverticula becomes a breeding ground for bacteria, leading to inflammation and ultimately diverticulitis, inflammation of the diverticulum. Bladder diverticulitis is relatively uncommon, and precise epidemiological data is lacking. However, its incidence increases with age, particularly in men. This is directly related to the higher prevalence of benign prostatic hyperplasia, or enlarged prostate, which contributes to bladder outlet obstruction. Individuals with neurological conditions affecting bladder function are also at increased risk, regardless of age or sex. Determining the specific number of cases is difficult because many individuals may have bladder diverticula without developing diverticulitis, and the condition can be asymptomatic. The signs and symptoms of bladder diverticulitis can vary, but often mimic those of a urinary tract infection, or UTI. Common symptoms include frequent urination, urgency, painful urination, and a sensation of incomplete bladder emptying. Patients may also experience lower abdominal pain or discomfort, and in some cases, blood in the urine. Fever and chills are indicative of infection, and the persistent inflammation can cause recurrent UTIs. It's important to note that some individuals may have bladder diverticula and experience no symptoms at all, only discovering the condition incidentally during imaging for other reasons. Diagnosing bladder diverticulitis usually involves a combination of clinical evaluation and imaging studies. A urine analysis will help identify any infection. Cystoscopy, where a thin tube with a camera is inserted into the bladder, allows direct visualization of the diverticula. Imaging modalities such as CT scans or MRI can provide detailed information about the size, location, and number of diverticula, as well as assessing for any complications such as abscess formation. Avoiding cystoscopy, which involves filling the bladder with contrast dye and taking X-rays during urination, can help identify bladder outlet obstruction and the presence of diverticula. While we don't typically categorize bladder diverticulitis into distinct types, we often classify it based on its origin: congenital or acquired. Congenital diverticula are rare and present at birth, usually due to a weakness in the bladder wall. Acquired diverticula, as we've discussed, are far more common and develop later in life, almost always due to bladder outlet obstruction. This distinction is important because it influences the underlying cause and, consequently, the treatment approach. The treatment and management of bladder diverticulitis depend on the severity of symptoms and the presence of complications. If diverticulitis is present, antibiotics are crucial to treat the infection. Addressing the underlying cause of bladder outlet obstruction is essential to prevent recurrence. This may involve medications to relax the prostate, such as alpha blockers, or surgical intervention to remove the obstruction. In some cases, surgical removal of the diverticulum itself, called diverticulectomy, may be necessary, particularly if the diverticulum is large, causing recurrent infections or not emptying properly. Minimally invasive techniques, such as laparoscopic or robotic surgery, are often preferred. Catheterization may be necessary to ensure complete bladder emptying during recovery. Preventing bladder diverticulitis primarily focuses on addressing the underlying causes of bladder outlet obstruction. Early detection and management of conditions like benign prostatic hyperplasia are crucial. Maintaining healthy bladder habits, such as complete emptying of the bladder when urinating, and avoiding chronic constipation can also help. For individuals with neurogenic bladder, proper bladder management techniques, including intermittent catheterization, are essential to minimize bladder pressure and reduce the risk of diverticula formation. The prognosis for bladder diverticulitis is generally good, especially when the underlying cause is addressed and treated effectively. While recurrence is possible, it can be minimized with proper management. Ongoing research focuses on improving diagnostic techniques and developing less invasive surgical approaches. Furthermore, research is aimed at better understanding the interplay between bladder outlet obstruction, inflammation, and the formation of diverticula to develop more targeted prevention and treatment strategies. New imaging modalities and targeted therapies hold promise for improving the long-term outcomes for individuals with this condition.